thing, having this session on robotic cystectomy, I can remember, and some of us who were doing this early on, I think everybody up here, 4 or 5 years ago being at the AUA at the national meeting, and having very, very few reports, and certainly the audiences were sometimes hostile, and there was really a lot of resistance to this. And then to flash forward to now and to have sessions like this, and at the World Congress of Endourology last fall, there were 24 papers presented on it. So I think we've come a long way, and along it, now, albeit I'm biased in it, I think the steps in approaching this, I think, have all been done with a lot of care and in a stepwise way. I think our experience from robotic cystectomy has emerged out of our experience from prostatectomy. As was mentioned, it's a natural extension of that. There are a variety of potential benefits, less pain and blood loss, things we see with prostatectomy, maybe some additional benefits of less fluid imbalances and bowel manipulation. But any such benefits must be weighed against several potential concerns, and the first and foremost is the oncologic integrity of this operation. I think we all would agree that bladder cancer is kind of a little bit of a different level when it comes to the impact it can have. It is a potentially lethal tumor, often unforgiving tumor, and nothing we should do should compromise that as well. And where I mentioned there's been a lot of, to some aspects, resistance from the community originally, the oncologic community, to this, I think on our end we need to be careful too on how we approach any novel procedures in the internet and direct marketing. I guess I especially feel this way for bladder cancer because of its unforgiving nature. And again, we got to be a little bit careful in what we put out there. For example, the bottom statement is from an academic center, and to me, it really doesn't make sense. And again, we need to be careful. And in this aspect, I think it's important that we maintain the principles of bladder cancer surgery and how we approach it, who we take to the operating room, our perioperative management, make sure we're doing the correct cystectomy and lymphadenectomy and beyond. And the priorities, as I alluded to before, are first and foremost the oncologic outcomes. And we can measure these in different ways, and we're starting to get some good outcome measures with this, but can use some surrogates as well. The morbidity and even long-term morbidity, I think we need to start thinking about this. What is the true impact to our patients? And evaluate other aspects of this. Is this something that's teachable, learning, and learnable, and what are the costs?